One word followed by a number and a letter could determine when people in Ohio, Indiana, and Kentucky get a coronavirus vaccine. The first doses are already going into the arms of frontline healthcare workers and those living in long-term care facilities. They're in what the CDC calls Phase 1A. Yesterday, an advisory panel outlined who should be in the next two tiers. Phase 1B includes people 75 and older, along with firefighters, police officers, teachers, corrections workers, certain manufacturing sectors, postal workers, public transit operators, and grocery store employees. Following those tens of millions of people is Phase 1C, which includes people 65 to 74, those who are 16 to 64 with medical conditions like obesity and cancer. 1C also includes food service and utility workers, among others.
Their next suggestion is just huge. The number of people who would fall into it.
That's how Kentucky Governor Andy Beshear responded this afternoon when asked about the new guidance. It's not clear if the Bluegrass State will deviate from the CDC's advice, but Beshear said age is a key consideration because older Kentuckians are more prone to die from COVID-19.
But if we're going to prioritize the vaccine to save lives, certainly we have to be looking at age.
Friday, I asked Ohio's lieutenant governor about the vaccine's next phases, and he made it clear the CDC will help determine when Ohioans start getting protection from the coronavirus.
But let me just say this. We're going to stick very closely to the recommendations that come from the experts at the CDC. There are details that we might refine about it, but we're going to stick to the medical guidance on how to do this.
Yeah, and you just heard there Lieutenant Governor Houston telling me that some of the details of these suggested phases could be refined, but he said Ohio's plan is to stick to the CDC's medical guidance. Reporting live tonight, Todd Dykes, WLWT News 5.
And Todd, we know Governor DeWine also talked about the vaccine rollout today. Are he and the Lieutenant Governor on the same page?
You know, Ashley, I was listening closely to see what Governor DeWine had to say. I can tell you he and the Lieutenant Governor seem to be, he's a little less emphatic about sticking so closely to the CDC's advisory panel guidelines than the Lieutenant Governor because the groups in the next two phases are just so huge. There's so many. Like his counterpart over in Kentucky, DeWine said saving lives, especially when it comes to older Ohioans, is paramount. And DeWine said the vaccine system simply can't be made too complicated because, as he said in his words, we are in a race against time. Ashley?
All right, Todd Dykes reporting live for us. Thank you, Todd.